My name's Annette, and I'm the proud mother of 6 children. Bailey, when she was first born, we knew something wasn't right with her. So it took us 15 years to find out what Bailey finally had. It was confirmed that she had CVID. Just seeing her going through the challenges of always sick and in the hospital, it hit home. I get emotional. But it's hard. When Bailey was diagnosed and started on Hizentra, it just became part of her everyday life and our everyday life. In the beginning, we would all get together and watch a movie or do something with her doing her infusions. And it just became part of her life and our life. So for 15 years, I had been dealing with Bailey as well as my other kids just in normal everyday life. So as a parent, you kind of downplay anything that's wrong with you. You're always there for their needs first. And then it was 8 years of me fighting something called H. pylori. We had 4 doctors involved and several biopsies. The gastroenterologist was baffled. They decided, well, let's test you and see if you might have what Bailey does. And it was conclusive that I have the same thing as Bailey. When I started Hizentra, I had a greater appreciation for what Bailey was going through, and I kind of looked at it a little bit differently because now we share the same disease and I can relate to her a little more and I can sympathize on what she went through, and we just kind of help each other now.
Important safety information. Warning: thrombosis, blood clots, can occur with immune globulin products, including Hizentra. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. See full prescribing information, including boxed warning, as well as important safety information at the end of this video or at hizentra.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.
When prefilled syringes came out, I called my doctor, and then I was able to do the 30-day free trial. So for me, prefilled syringes are simple, convenient, and ready to use. I just take it out of the box, twist it onto a syringe-to-syringe transfer device, and I just push it and the medicine goes in there with one push. I was excited when I learned about the prefilled syringes. I have to admit, I kind of thought, wow, I get to do something before Bailey does. I get to be the one to show her how this works instead of the other way around. It's been a game changer for me, and it's great. With Bailey, I mentioned the prefilled syringes to her. It was, Mom, I'm doing just fine. If it's not broke, don't fix it. I was able to show it was more efficient for me. She was like, wow, this is pretty neat. So with prefilled syringes, I felt like for me, it cut out some steps when I would set it up. It was more efficient. It gave me the flexibility to do it on my terms. When I didn't have people here, if my hands were bothering me that day, I'd have to be on their schedule and wait for somebody to help me with drawing out the medication from the vials. So with the prefilled syringes, it gives me more freedom to do my infusions when I want to do them, and it makes me more compliant. I just think with the prefilled syringes, it's just giving me the freedom to do what I want to do on my terms. I'm in control of what I do. And even though I might have limitations, it's given me that back.
Important safety information. Warning. Thrombosis, blood clots, can occur with immune globulin products, including Hizentra. Risk factors can include advanced age, prolonged immobilization, a history of blood clotting or hyperviscosity, blood thickness, use of estrogens, installed vascular catheters, and cardiovascular risk factors. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Treatment with Hizentra might not be possible if your doctor determines you have hyperprolinemia, too much proline in the blood, or are IgA deficient with antibodies to IgA and a history of hypersensitivity. Tell your doctor if you have previously had a severe allergic reaction, including anaphylaxis, to the administration of human immune globulin. Tell your doctor right away, or go to the emergency room if you have hives, trouble breathing, wheezing, dizziness, or fainting. These could be signs of a bad allergic reaction. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. Inform your physician if you are pregnant or nursing or plan to become pregnant. Infuse Hizentra under your skin only. Do not inject into a blood vessel. Self-administer Hizentra only after having been taught to do so by your doctor or other healthcare professional and having received dosing instructions for treating your condition. Immediately report to your physician any of the following symptoms, which could be signs of serious adverse reactions to Hizentra: reduced urination, sudden weight gain, or swelling in your legs, possible signs of a kidney problem, pain and/or swelling or discoloration of an arm or leg, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, unexplained rapid pulse, or numbness or weakness on one side of the body, possible signs of a blood clot, bad headache with nausea, vomiting, stiff neck, fever, and sensitivity to light, possible signs of meningitis, brown or red urine, rapid heart rate, yellowing of the skin or eyes, chest pains or breathing trouble, fever over 100 degrees Fahrenheit, possible symptoms of other conditions that require prompt treatment. Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, and its variant, VCJD, cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. Before receiving any vaccine, tell immunizing physician if you have had recent therapy with Hizentra, as effectiveness of the vaccine could be compromised. Please see full prescribing information for Hizentra, including boxed warning and the patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.